Chapter 12, Spirituality. The Chapter 12 objectives for spirituality chapter include describing the difference between spirituality and religion, explaining how understanding spirituality assists the nurse in identifying coping and support systems for the patient, explain how spiritual beliefs can influence decision making in healthcare, and discuss why it's important for nurses to be aware of their own beliefs and biases in relation to healthcare. So, spirituality in healthcare. We assess this because we know that the factors can influence health decisions and outcomes. Spirituality affects lifestyle practices, religious practices, dietary beliefs, and many aspects of religion and spirituality can affect overall health of your patient. So when we're talking about holistic care, we're talking about the whole patient. And this can change from generation. Um, the younger patients, you might find there's a trend that may be more spiritual than religious and traditional. So things are always changing, but we should always ask. So some of the terms to look at in this chapter are religion, which is the formal, organized, group-oriented, those type of things. Spirituality, which can be a search for life, meaning, purpose. It's informal, it's not organized, very self-reflective. Spiritual assessment is an active and ongoing conversation where we assess the spiritual needs of the client. It can be formal and informal, uh, respectful, non-biased. So spiritual care is addressing the spiritual needs of the client through this spiritual assessment. So we can impact the client's health, give them a greater sense of well-being in the face of all these disease management that is occurring in the hospital setting. This can be a powerful coping mechanism, especially at end of life for not only the patient but for family as well. So some of these spiritual practices can encourage greater physical and mental health. So some of the examples might be prayer or participation in yoga, meditation, reflection, any of those activities that can help move them in that direction. So some of the religious beliefs may be wide and various. All the different practices, the rituals. There's different ways people deal with end-of-life issues, and we want to be non-biased and talk to patients about their preferences. So it's good to have an understanding of a working knowledge of ideas, beliefs, and practices, but that doesn't mean that every patient is going to follow those exactly to a T. We are always going to treat the patient as an individual in their spiritual care. It's very subjective and can vary greatly and can be very, very personal. But being respectful and asking questions to care for your patient is helpful. And some things that spiritual experiences or history can guide some of the conversation, always allowing the patient to share what they are most comfortable with. So, in some situations, spirituality can impact the patient negatively. Maybe they choose to pray about it rather than seek timely medical care. Maybe they withhold standardized medical care based on their religious traditions. Sometimes um, uh, there is some examples of different religions that want to take care of things on their own rather than have Western medicine, um, refusing blood transfusions due to their beliefs. So this can cause some anxiety and depression for the patient, and don't want to be disappointment to the family, not meeting group expectations. So this can be very stressful for the patient. So in this situation, if you are presented with this, that might compromise your nursing care with that patient, you should look for resources to help you navigate this situation, because we want to provide safe and effective care honoring the patient's wishes, and this can be a challenge sometimes, and so don't hesitate to tap into your resources. We can also tap into the ethics committee if there's concerns in that way. We would take that up the chain to help provide the best care for your patient. So you can incorporate spirituality into your assessment practice if the patients are like, well, how can I pray? How can I do anything? I'm getting bugged all the time. People are coming in my room all the time. I have no privacy. Have this conversation with the patient and then honor it. You could give them a time of silence, encourage meditation or music, maybe a prayer time. You can invite a chaplain to come speak to them. We should always be respectful and open and discuss issues if you are comfortable doing that. You always got to honor yourself as well. We don't want to convey any judgment with their beliefs or religious practices. You do not have to agree with somebody's religious practices to be respectful to them. So when you're doing your spiritual assessment, most of the time it's very informal. The client is the focus. You don't have to be spiritual yourself to understand that that's important for your patient. Being objective is the key. You're going to ask questions about those spiritual beliefs that might affect their care. And then you can support or encourage um, anything that might help your patient with their spirituality and peace and overall health. Some may not be connected to a religious group, as we talked about earlier, so it may be difficult for them to identify anything, but you can help them with that. So whatever provides strength and peace in dealing with healthcare issues should always be encouraged. So in summary, learning what's the difference between spirituality and religion, and why this is important in identifying these coping mechanisms and support systems for your patient. Do you know the definitions of religion, spirituality, spiritual assessment and care, as well as spiritual distress? If someone is having challenges with this, do you understand why this is important to acknowledge? And as a healthcare provider, does your self-understanding of spirituality make a difference in your sympathy and empathy for your patient? Also, what are the acronyms for HOPE and FICA? We know that you're doing your cultural and spiritual self-assessment, and some of those are brought up there as far as analyzing and self-assessing your spiritual history. Thank you, and this is Chapter 12.